Biden actively supported the ACA, known as ObamaCare, and the lies that were told to the public were exposed when millions of Americans lost their existing health care plans if they did not conform to the much more expensive ACA requirements. Longtime patients lost their doctors, which they were told would not happen, and many doctors in private practice, seeing that Medicare payments would not cover their operating expenses, simply retired from the practice of medicine. Simply put, it was a bad law that crippled the economy across the board, a true result of a socialist-inspired policy mandate, which Joe Biden totally supported. Obama and Biden claimed that it was not a tax, but in fact it was. And when challenged to the Supreme Court, the justices ruled it was legal because it is a tax and Congress can make tax laws. But guess who lobbied Biden and other Democrats to get the law passed? That's right, the major insurance companies, because they believed that they would make more money since the government was covering the bill. And with the mandatory tax imposed for those who did not buy it and the high cost of coverage that locked it in, it was a win for everybody. Those people who lost full-time working status in many cases took second part-time jobs, which were continuously added to the Obama-Biden unemployment figures, providing a false impression of higher employment in the country. While Biden mostly served in the role of behind-the-scenes advisor to Obama, he was very active in formulating federal policies.
Child care, elder care, making sure that we continue to strengthen our healthcare system, making sure that we're able to make every single solitary person eligible for what I've been able to do with the COVID. With dealing with everything we have to do with. Look, if we finally beat Medicare.
Thank you, President Biden. President Trump?
Well, he's right. He did beat Medicare. He beat it to death, and he's destroying Medicare because all of these people are coming in. They're putting them on Medicare. They're putting them on Social Security. They're going to destroy Social Security. This man is going to single-handedly destroy Social Security. These millions and millions of people coming in, they're trying to put them on Social Security. He will wipe out Social Security. He will wipe out Medicare. So he was right in the way he finished that sentence, and it's a shame.
Now, we're 10 hours away from government funding expiring, simply because the Republicans are not serious about keeping it open.
I don't know if the Democrats are ready. They've got a big conference meeting tomorrow. I do know this, and I say this with respect. They won't get what they've asked for. They want us to agree to an automatic extension on the subsidies for the Affordable Care Act, and the premiums are coming out, as you know, and I think any fair-minded person can look at these premium increases, subsidies or no subsidies, and conclude that the Obamacare exchanges just aren't working. They were supposed to reduce the cost of health insurance, and instead they're going up, premiums going up 6 to 8%. So if you just unconditionally extend the Obamacare exchanges with the subsidies, all you're doing is putting paint on rotten wood.
All right, let's turn to Capitol Hill for the latest on the government shutdown, now in its 24th day. Joining us right now is House Minority Leader Hakeem Jeffries of New York. Leader, thank you for being with us this morning. I think the big question is, how do we get out of this?
That's an important question, and we continue to maintain that we will sit down with our Republican colleagues anytime, any place, here at the Capitol, or go back to the White House to enact a bipartisan spending agreement that actually meets the needs of the American people, improves their quality of life, lowers costs in an environment where inflation continues to move in the wrong direction. And we also need to decisively address the Republican healthcare crisis that is crushing people all across the country, particularly now that tens of millions of people are receiving notices that their healthcare premiums are about to skyrocket.
There was an op-ed in Roll Call recently that was pretty interesting on this. It said what you are asking the Republicans to do right now when they control the White House, the Senate, and the House is effectively what the Democrats could not do when they controlled all three of those heads of government themselves. The 10-year setup for this, for these, or the 3-year setup for the expiration of these credits was intentionally put in. It was put in when you controlled the White House, the House, and the Senate. You couldn't get it passed for longer. And so this is a setup that kind of your own creation that you all couldn't extend beyond that. Now you want the Republicans to do something you didn't do when you were in power?
It's not a setup beyond what we could do. We extended the Affordable Care Act tax credits in 2022 for 3 years. The program is working. It's providing health care to tens of millions of people in an affordable way, and it should be continued. It's interesting to us that Republicans decided that they would prefer to permanently extend massive tax breaks for their billionaire donors in their one big ugly bill, which also at the same time dramatically increased the debt and enacted the largest cut to Medicaid in American history, but refused to consider extending Affordable Care Act tax credits that actually benefit working class Americans, everyday Americans, and middle class Americans.
When they calculated unemployment, they never counted those discouraged workers who had given up looking for a job and dropped out of the workforce. Likewise, in order to appear better politically, the Obama-Biden administration began counting part-time and temporary employment into the job numbers. Biden personally led the charge to perform damage control after the Affordable Care Act passed in the dark of night without a single Republican vote in support of it. The Patient Protection and Affordable Care Act was signed into law on March 23, 2010. The law mandated that businesses with more than 50 full-time employees under the new law had to provide exhaustive and costly coverage to those workers. The end result was that companies then had to make hard choices. Some downsized their workforce below 50 workers. Some made their full-time workers part-time. While some companies simply moved their businesses overseas, many to China, Vietnam, Cambodia, and Europe, for cheaper operating expenses to escape the unaffordable insurance requirements.
Their priorities are misplaced, and as Democrats, we're going to continue to fight for the American people all across the country, in rural America, urban America, small town America, the heartland of America, and of course, black and brown communities throughout America, all of whom are being devastated by this Republican healthcare crisis.
Leader Jeffries, we were just joined by Senator James Lankford from Oklahoma. He's a Republican, and his concern with this was that the ACA subsidies aren't helping bring costs down overall. He said that in his state, Oklahoma, if you look over 6 years from 2013 to 2019, premiums for ACA plans were up by 200% versus premiums being up by 29% for commercial plans in his state. His concern is that there's something that needs to be fixed within this. Some of the things he threw out would be things like limiting fraud by just requiring that there be at least a $20 premium or some premium that's put down instead of zero premium so that people get enrolled in things without even knowing that they're enrolled in some of these programs. What do you say to that?
We've made clear in the House that we will consider anything that emerges from the Senate in good faith in a bipartisan way that both reopens the government while at the same time addresses this healthcare crisis and extends the Affordable Care Act tax credits in a meaningful way. The 90% or so of the people who benefit from these Affordable Care Act tax credits make $63,000 per year or less. And a significant number of small businesses and entrepreneurs across the country rely upon the Affordable Care Act tax credits in order to provide health insurance for themselves and for their families. So this is an issue that needs to be addressed. In fact, we know that red state residents actually are disproportionately higher represented in terms of the Affordable Care Act tax credits than any other part of the country. And so we're fighting for the American people here.
Finally, after months of asking, months, and mounting pressure, Leader Jeffries and I went to the White House yesterday to meet with the president and Republican leaders to find a way forward. And sitting in the room, it was very clear, behind closed doors, that the president hasn't fully grasped the magnitude of the disaster he's causing Americans.
These government health care plans that you've proposed in one form or another, this is a show of hands question, and hold them up for a moment so people can see. Raise your hand if your government plan would provide coverage for undocumented immigrants.
we're back with the top Democrat in the House, Leader Hakeem Jeffries. He joins us from his Brooklyn, New York district. Good morning.
Good morning. Great to be with you.
Well, Leader Jeffries, Treasury Secretary Bessent said the shutdown is starting to affect the economy, and by November 15th, the troops will not be paid. Do you expect the shutdown to last that long?
I certainly hope not. This is day 26 of the Trump Republican shutdown, and as Democrats, we've maintained from the very beginning and continue to maintain we will sit down anytime, any place with anyone, either at the Capitol or back at the White House, to reopen the government, to negotiate a bipartisan spending agreement that actually meets the needs of the American people, and to decisively address the Republican healthcare crisis, particularly as it relates to the urgent need to extend the Affordable Care Act tax credits so we can prevent tens of millions of Americans from experiencing dramatically increased health insurance premiums that will make access to a doctor unaffordable.
As costs continue to skyrocket for Americans, thanks to Trump's tariffs, economic policies.
Well, we do see GOP leaders as they are stepping up to give their update on the government shutdown. Let's head over there live.
Oh dear, what the heavens?
Good morning, everybody. Welcome to day 28 of the Democrat shutdown. We're almost a month into this, and we wanted to highlight a couple of things and a few members this morning. There are some very important developments. But before we get to all that, one of the things that we wanted to note is that really it's painfully obvious to everyone the true motivation of the Democrats' historic obstruction has now become very clear for everyone. I want to use a little simple graph. Lily, if you show me this real quick. Just real quick, simple facts, because these things get obscured too much. But there are simple facts about the Democrat shutdown that everybody needs to recognize. Here's 4 of them. First of all, we have to have Democrats to reopen the government. You know that in the Senate, it requires 60 votes to break an impasse. Wait, hang on, Lily, hold it real here. Keep it close to the podium. I want everybody to see this, okay? We're going to make it simple. I had my 15-year-old son and some of his friends were together over the weekend, and they wanted me to explain it to them as simply as possible. This is the little formulation, okay? Hey, fellas, remember from civics, you got to have 60 votes in the Senate. We only have 53 Republicans, so we must have Democrats to do it. The Democrats are out trying to claim that this is all on Republicans because we control the government. We don't control the Senate without 60 votes, so you have to have them. Now they've voted 13 times, those Senate Democrats, counting the House and the Senate together, they voted 13 times to keep the government closed. And what they're demanding as a ransom to reopen the government are some really crazy things. They want to restore $200 billion in health benefits paid for by U.S. taxpayers to illegal aliens and non-citizens. We can't do that. They want billions of dollars in wasteful programs to be returned to foreign countries for things that none of you would agree with. We're not going to do that. They want $500 million to go back to left-leaning news organizations, paid for by taxpayers. We can't do that. And then they want to cut $50 billion from the Rural Hospital Fund that Republicans got signed into law July 4th to prop up health care in red states and rural areas around the country. It's too important, but they want to take that away. They know that we can't do it. And now that they've begun to admit what this is all about, thanks, Lee, put another thing there. They're admitting what they're up to. Chuck Schumer said every day of the shutdown gets better for us, meaning the Democrat Party. And you know, we had the second-ranked Democrat in the House, the minority whip.
Senate Democrats had better be ready to go public with their blatant disregard for Americans hurting in now day 23 of the federal government shutdown. That's because Republicans are about to force a vote today to allow paychecks to continue for America's essential workers. The money flow is grinding to a halt now deep into the shutdown. So will Democrats then vote against that? It will be for the world to see if and when they do. And we're talking about active duty military men and women, air traffic controllers, some of their support staff, technicians and engineers, law enforcement, you know, the people who keep us safe. Senator John Fetterman is calling out his fellow colleagues who keep voting to keep the government closed. They did it for a 12th time yesterday.
I'm always going to vote country over my party, and if I pay a price within my base, you know, that's something I'm willing to do. I'm not afraid to tell my truth. And if I'm going to pay a penalty, I'm not afraid of that. It's wrong to shut our government down.
Republicans are going after what they call cold-blooded politics. You often hear me say politics is a blood sport. I'm not kidding. They say Democrats are using American families as pawns. House Minority Whip Catherine Clark laid out the Democrats' strategy to our own Chad Pergram. Watch this.
Shutdowns are terrible. And of course, there will be, families that are going to suffer. We take that responsibility very seriously. But it is one of the few leveraged times we have.
Leverage. Suffering becomes your leverage.
Who just said a few days ago, the end of last week, that we know that this is causing great pain for the American people, but we have to use this leverage. We don't have many times where we have leverage like this. And so they've shown you what the real motivation is. But ultimately, why are they doing all that? Let me summarize this really quickly, as simply as I can, for the civic students back home. Republicans are not demanding anything, literally nothing. All we want is to reopen the government. The Democrats are demanding all those things I just showed you on the chart, plus a lot more. When I say they want to send money to foreign countries, this is some of the things that they would propose that we spend money on again. They're demanding, this is a ransom to reopen the government. Things like $4 million for global LGBTQI plus awareness campaigns around the world. $4 million for the LGBTQI plus democracy grants in the Balkans. They want $2 million for feminist democratic principles projects in Africa. We're not doing that. But again, the question is why? Why? This sounds crazy. It is. Why would they do this? And what we saw on vivid display over the weekend was the re-emphasis of this fact. This is motivated purely out of fear. And what do we mean by that? You saw the Democratic leader in the House, Hakeem Jeffries, endorse Zoran Mamdani for mayor of New York City on Friday. It was an illustration of what we're facing here. The Democrats right now fear the far left activists more than they fear air traffic controllers, border patrol agents, American service members, and so many others missing their paychecks. They fear the Marxist insurgents like Mamdani more than they fear families and children going hungry from lapsed benefits that keep food on their tables.
In fact, I'm perfectly willing to guarantee Democrats a vote. But none of that is going to happen until Democrats reopen the government. We're not going to negotiate on anything until Democrats stop holding government funding hostage. And if they really want to address their Obamacare mess, they should stop running out the clock on a deal. And all they're doing by that action, Mr. President, is keeping the government shut down and enhancing, believe it or not, the chances this situation doesn't get fixed.
Americans are prepared to spend 114% more.
We're not willing to be prepared to spend more.
Coronavirus pandemic has claimed the lives of roughly 190,000 people. Our best hope to stop these deaths is a safe, effective COVID-19 vaccine. So, Dr. Adams, let me start with you. Estimates vary, but some epidemiologists believe that at least 70% of the population will need to be immune to COVID-19, ideally through taking the vaccine, in order to provide herd immunity necessary to end this pandemic. Is that correct?
Yes, ma'am. The estimates that I've seen from experts range from 60% to 90%, but we certainly need to get over half of the population vaccinated so that we can achieve herd immunity and stop the transmission of this virus.
Okay, so as I hear it, kind of our minimum target would be about 70%, give or take. So the question is, can we do that? Now, the last flu season, for which we have complete data, less than half of U.S. adults, only about 45%, got the flu vaccine. Currently, a CBS News poll shows that only 21% of people surveyed would take a coronavirus vaccine as soon as it became available. Convincing enough Americans to take a COVID-19 vaccine is a big job. So let's talk about what makes it harder and what makes it easier. People are more likely to be vaccinated if they trust that federal officials are basing a vaccine decision on science and on data and not on politics or self-interest or conspiracy theories.
Thank you, Mr. Chairman. So last November, while you were under consideration to become Secretary of Health and Human Services, Mr. Kennedy, you said, quote, if vaccines are working for somebody, I'm not going to take them away. No exceptions, no ifs, ands, or buts. You would not take away vaccines from anyone who wanted them. Then last week, you announced that the COVID-19 vaccine is no longer approved for healthy people under the age of 65. In announcing the change, you said the vaccine will be available for anyone who wants it. Now, obviously, both things cannot be true at the same moment. So let's clear this up right now, Secretary Kennedy. Will you tell America that all adults and all children over 6 months of age are eligible to get a COVID booster at their local pharmacy today?
Anybody can get the booster.
I'm sorry?
Anybody can get it.
Anybody. So you're saying that is now the official rule of HHS. Anybody is eligible to get a booster by just walking into the pharmacy.
It's not recommended for healthy people.
No. If you don't recommend, then the consequence of that in many states is that you can't walk into a pharmacy and get one. It means insurance companies don't have to cover the $200 or so cost. As Senator Dr. Cassidy said, you are effectively denying people vaccines.
We're not going to recommend a product for which there's no clinical data for that indication. Is that what I should be doing?
What you should be doing is honoring your promise that you made when you were looking to get confirmed in this job.
You're going like this.
And that is, you promised that you would not take away vaccines from anyone who wanted them. You just changed the classification of the COVID vaccine.
I'm not taking them away from people, Senator.
It takes it away if you can't get it from your pharmacist.
Well, most Americans are going to be able to get it from their pharmacy for free. Most Americans will be able to get it from their pharmacy for free.
The question is, everyone who wants it, that was your promise.
I know I didn't. I never promised that I was going to recommend products with which there is no indication.
When you said...
And I know you've taken $855,000 from pharmaceutical companies, Senator.
Did you hold up a big sign saying that you were lying?
You know, what I find a little bit weird in this discussion, I'm hearing it over and over again this morning, Mr. Chairman, is we've got the entire medical community on one side. You got the AMA representing hundreds of thousands of doctors, the American Academy of Pediatrics, the American Public Health Association. All of these organizations are telling us that COVID vaccine and vaccines in general are safe and effective. You are casting doubt on that. Who are who are the organizations that are agreeing with you and casting aspersions on vaccines?
The primary advisors are Marty McCary, Jay Bhattacharya, Dr. Oz, Vinay Prasad.
So you got a few doctors who agree with you, and I'm giving you the
Not a few doctors. What you're talking about is there's a big difference, Senator, between established science and the scientific establishment, which has been co-opted by the pharmaceutical industry.
Hold on. So you're telling the American people that the American Medical Association, representing hundreds of thousands of people, have been co-opted and that they should not trust their doctors. And the American Academy of Pediatrics, and by the way, just for the record, every single Republican, I don't mean to be political here, Mr. Chairman, has received PAC money from the pharmaceutical industry. Are they all corrupt as well?
And I'm telling you, the American Heart Association has been co-opted by the food
Everybody but you, Senator. But you know what? When you ran for president, we have a corrupt campaign finance system. Maybe you will agree with me on that. Okay, you were already president, you got a billionaire behind it. You received $300,000 from people, not from the industry, people in it, as I did, from individuals. You corrupt. President Trump got $3 million. Every Republican got corporate PAC money for the pharmaceutical industry. Democrats as well. Everybody is corrupt, but you?
Raise your hand if your government plan would provide coverage for undocumented immigrants.
On their health insurance. That's right, that just came out. According to the Kaiser Families Foundation's analysis today, without ACA premium tax credits, premiums will double, more than double on average. And this not only affects those on ACA, it affects just about every American family with health insurance.
He was right, he did beat Medicare, he beat it to death, and he's destroying Medicare because all of these people are coming in. They're putting them on Medicare. They're putting them on Social Security. They're going to destroy Social Security. This man is going to single-handedly destroy Social Security. These millions and millions of people coming in, they're trying to put them on Social Security. He will wipe out Social Security. He will wipe out Medicare. So he was right in the way he finished that sentence. And it's a shame. What's happened to our country in the last 4 years is not to be believed.
Because it is, as has been documented, when they get the deep cuts on ACA and on Medicaid, they don't have as much money. They raise the costs on everybody else.
The reason why the Democrats want more subsidies and tax credits to the ACA is so they don't lose their fraud, waste, and abuse that they have collected for 320 years. Doge, Medicare, Medicaid, welfare.